About 20% of patients with unprovoked venous thromboembolism have a recurrence within 2 years after the withdrawal of oral anticoagulant therapy. One can extend anticoagulation, which of course prevents recurrences, but of course also this strategy is associated with increased bleeding. But what about switching to aspirin after anticoagulation is over? Now in the New England Journal of Medicine, researchers report a multicenter double-blind study in patients with first ever unprovoked venous thromboembolism who had completed 6 to 18 months of oral anticoagulant treatment and then were randomly assigned to aspirin 100 milligrams daily or placebo for a total of 2 years. The primary efficacy outcome was recurrence of venous thromboembolism, and major bleeding was the primary safety outcome. They found that venous thromboembolism recurred in 7% of patients who received aspirin and 11% of patients who received placebo. During a median treatment period of 24 months, 6% of patients taking aspirin and 11% taking placebo had a recurrence. On the downside, one patient in each treatment group had a major bleeding episode, and adverse events were similar in the two groups overall. So what should be the strategy? Aspirin reduced the risk of recurrence when given to patients with unprovoked venous thromboembolism who had discontinued anticoagulant treatment, with no apparent increase in the risk of major bleeding. Sounds like a pretty good strategy to me. I'm Peter Block, and this is a CardioSource Heart Minute.